Hello toppers, today we will be seeing mnemonics and most commons regarding nasal cavity. Already in one video we had seen regarding the anatomy and physiology of nose, and this will be a continuation. The first, causes of depressed or saddle nose. First thing will be coming in our mind is syphilis, but there are a lot of causes, so let's see. So the mnemonic is heart, salt, H is for hematoma, then O is for operative, that is excessive removal of septum during submucous resection, then trauma, S for syphilis, A for abscess, L for leprosy, and T for tuberculosis. Most probably we will be going with syphilis and leprosy, but we won't be remembering other causes, so heart, salt we can remember easily. Most common malignant tumor of nose involving the nasal skin, it is basal cell carcinoma, and the most common site is nasal tip and ala. Most common symptom of RHINOSCLEROMA is nasal obstruction and crusting. There are two types of cells we can see in case of RHINOSCLEROMA. Those are Meculac cells and Russell bodies. Then comes SAMSTER'S triad, you might be knowing. It is asthma, then aspirin intolerance, then nasal polyp. You can remember as Sam said na, NAA, that is nasal polyp, aspirin intolerance and asthma. Most common nasal mass, it is nasal polyp only, which we can see in our OPDs. Then mitral cells, where we can see, it can be seen in the olfactory bulb of the olfactory tract. Then frog face deformity, where we can see, and the answer is ethmoidal polyp. VIDIAN neurectomy is done in which condition? This is one of the most important MCQ. In vasomotor rhinitis. Rhinitis medicamentosa is due to, with the name itself we can identify something is related to medicine. So the answer is excessive use of topical decongestant nasal drops. Because of its overuse, rhinitis medicamentosa will happen. Most common cause of epistaxis in children, everyone might be knowing, and it is one of the most important question. It is nose picking. Most common cause of epistaxis in adult, it is hypertension. Most common site of nosebleed in children and young people is Little's area. So you can remember children are very little, so the area is Little's area. Most common site of nosebleed in adult is Woodruff's area. So another one thing, like you have to know the exact location of this little area, Woodruff's area. That would be important question too. Most common sinus involved in adult, it is most common is maxillary, then comes frontal, then comes ethmoidal, then comes sphenoid. Try to remember maxillary in adults. Most common sinus involved in children, it is ethmoidal sinus. Most common sinus involved in chronic sinusitis is, it is also maxillary sinus. So in case of adult also it is maxillary sinus, and in case of chronic sinusitis also it is maxillary sinus. Potter's view, which sinus cannot be visualized? This question is little bit tricky. So, it is sphenoidal sinus, and there is also one clue. So, in case of Waters view with open mouth, we can easily visualize the sphenoidal sinus. So, be clear with the question whether it is with open mouth or without open mouth. Okay. Most common benign tumor of nose, capillary hemangioma. Most common benign tumor of paranasal sinus, it is osteoma, and the location is frontal sinus. First lymph node involved in maxillary sinus carcinoma, it is submandibular lymph node. So much.